So, good day everyone. My name is Ivan Costales from BSN1C, and today I'm going to give a physical assessment on my patient in head, neck, and in regional lymphatics. So, first, introduce yourself and identify your client and explain to the client the procedure. So, good day, sir. My name is Ivan Costales, and I'm your nurse for today. So what's your name, sir?
November start.
So, age po, not age.
12
Okay. And yung gagawin ko lang po today is i-assess ko lang po kayo sa head, neck, and regional lymphatics. Okay lang po ba sa inyo?
Yes, sir.
So, thank you po. And first, instruct the client that you will be touching the clients in various areas with different parts of your hand and provide warmth and privacy and well-lit room. So first, in the head and neck. Inspect the client's shape of the head and have the client sit in a comfortable position and facing the client with your head at the same level as yours. And inspect the head for shape and symmetry. So, tingnan lang po ng diretso sa akin. Thank you. And next, palpate the head. Place the finger pads on the scalp and palpate it in all of its surface, beginning in the frontal area and continuing over the parietal, temporal, and occipital areas. So, pwede po yung lumapit ng bawat. Okay. And next is assess for the contour and masses and tenderness of the hand. And palpate for the temporal artery, which is located anterior to the tragus of the ear. Okay, so dito po. Okay, so, thank you po. Okay, so next, inspect and palpate the scalp. And part the hair repeatedly all over the scalp and inspect the scalp for the lesions or masses and place the finger pads on the scalp and palpate for lesions and masses. This one po. Lapit po ng practice. Okay, so palpate po any lesions, masses. So, next, inspect the face. Observe the client's face or for expressions and shape and the symmetry of the following structures, which is eyebrows, eyes, nose, mouth, and ears. And note any swelling, abnormal features, or unusual movements. So, sir, pwede po yung humarap sa akin. Tingin lang po ng diretso sa akin. Okay, so thank you. Okay, so next, palpate and auscultate the mandible. Use the fingertips of both index and middle fingers to locate the temporal mandibular joint anterior to the tragus of the ears on both sides. And hold the fingertips firmly in place over the joints and ask the client to open and close her mouth. And observe the relative smoothness of the movement and whether or not the client notices any discomforts. Okay, sir, tingin na po yung diretso sa akin. So, open and close na. Isa na po, sir. Isa pa po. Nafe-feel po ba kayong masakit or any discomfort, sir?
Yes.
Yes. Thank you. So next, remove the hands and hold the belt of the stethoscope over the joint. Okay, so in the next step, we're going to use a stethoscope. And make sure that you will use the bell side of the stethoscope. And listen for any sound while the client open and close his or her mouth. Close open the picture. Okay, so next, let's inspect the neck. With the head in a central position, inspect for symmetry of the sternocleidomastoid muscles anteriorly and the trapezial posteriorly. So, straight lang po kayo sa akin, sir. Okay, sir. Straight lang po ito, eh. And next, have the client touch the chin to the chest, to each side, and to each shoulder. Okay, sir. Pwede po bang yung chin niya i-ano po dito sa chest niya? Parang luluwagan po kayo. Okay. So, sa tingin na po ng diretso. And dito po sa shoulder niya, sir. Tingin na po kayo. Okay. And dito naman po sa side. Next, assess for limitation of motion. And next, note the presence of the stoma or tracheostomy. And so next, let's palpate the neck. Stand in front of the client and with the finger pads, palpate the sternocleidomastoid muscles. So pwede pong tingnan po ng diretso. So, nakaka-feel po ba kayo ng discomfort? Or may masakit po ba? Next. Note the presence of masses or tenderness. And stand behind the client and with the finger pads palpate the trapezius and note the presence of masses or tenderness. Sir, Sir, so, sir, ipapalpate ko lang po yung dito sa may trapezius. Sir, pwede na po. Side po. Okay. Okay, so next, let's inspect for the thyroid gland. So have the patient face and ask the client to straight ahead with the head slightly extended. So and next, have the client drink a sip of water at least twice. That's why. That's really important. And next, ask the client to swallows and observe the front of the neck in the area of the thyroid and the isthmus for masses and symmetrical movement. And next, let's palpate the thyroid. Okay. In palpating the thyroid, let's do the posterior approach. So, have the client sit comfortably and stand behind the client. So, okay, so So next, have the client lower the chin slightly in order to relax the neck muscles. Okay, sir? Medyo yung upuan ng konti. Medyo yung ng konti. Basta mag-relax lang po. And next, place the thumbs in the back of the client's neck and bring the other fingers around the client's neck anteriorly with their tips and resting on the lower portion of the neck over the trachea. So next, move the finger pads over the trachea rings. So, palpate ko lang. And next, instruct the client to swallow and palpate the isthmus for modules or enlargement. Okay, sir? Pwede po ba kayong lumunok, sir? Isa pa po, sir? Isa pa po, sir? Okay. So, thank you po. And next, have the client incline the head slightly forward. So, sir, medyo yung mga na lang. And press the fingers on the left hand against the left side of the thyroid cartilage. So here, so cartilage like that. And to stabilize it while placing the fingers of the right hand gently against the right side. So, and instruct the client to swallow or sips of water. Lunak po kayo, sir. Isa po po, sir. Okay. So next, note the consistency or modularity and tenderness at the gland move upwards and repeat on the other side. Okay, sir. So pwede na po mag-side. No. So next, let's do the anterior approach. Here in this approach, you need to stand or sit in front of the client. And next, ask the client to flex the head slightly forward. So, sir, medyo mag-flex na po yung head. Hindi po ganun, sir. Hindi po. Basta stand straight. And next, place the right thumb on the thyroid cartilage and displace the cartilage to the client's right. Okay, sir. Dito po. The cartilage. Okay. And next, grasp and elevated the displaced right lobe to the thyroid gland with the thumb and index and middle fingers on the left hand. And next, palpate the surface of the gland for consistency, nodularity, and tenderness. And have the client to swallow and then palpate the surface again. Okay, sir. Lunok po kayo, sir. Isa po. And repeat the procedure on the opposite side. And next, let's auscultate the thyroid gland. Stand in front of the client and place the bell of the stethoscope over the right thyroid lobe. Okay. So we need to use our stethoscope again. And make sure that the side of the stethoscope you will use is the bell. And auscultate for breaths. And repeat on the left thyroid lobe. Next, let's inspect the lymph nodes. Stand or sit in front of the client and expose the areas of the head and neck to be assessed. And inspect for the nodal areas of the head and neck for any enlargement of or inflammation. Okay. So next, let's palpate the lymph nodes. Have the client sit comfortably and face the client and conduct the assessment of both sides of the neck simultaneously. And the next one is move the pads and the tips of the three fingers in small circular of palpation using gentle pressure. So here we are going to follow a systematic routine, which is the sequence beginning with the preauricular. Okay. And next is for the post-auricular. Okay. So make sure to use a circular motion when palpating. And next for the occipital. And next is for the submental. And for the submandibular or tonsil nodes. And moving down to the neck, evaluate the anterior cervical chain. And for the posterior cervical chain. And lastly, the supraclavicular nodes. Okay. And note the size and shape or delineation, mobility, and consistency and tenderness of the neck. Okay, so that's all.